Mr. President, I rise today to ask my colleagues to join me in recognizing June as National Alzheimer's and Brain Awareness Month. Every 67 seconds, someone in our country develops Alzheimer's disease. It is the sixth leading cause of death in the United States, yet it is the only disease in the top 10 that cannot yet be prevented, cured, or slowed. Of the 5.3 million Americans with Alzheimer's disease, 5.1 million are 65 and older, accounting for 96% of the diagnosed population. By 2050, the number of people 65 and older with Alzheimer's disease may nearly triple, from 5.1 million to an estimated 13.8 million Americans. The disease will take the lives of an estimated 700,000 seniors in the United States this year, and that number is rapidly rising. While deaths from other major causes have decreased in this country, deaths from Alzheimer's disease has increased significantly. Between 2000 and 2013, deaths attributed to Alzheimer's disease increased 71%. While deaths attributed to heart disease, the number one cause of death in the United States, decreased by 14%. The devastating disease is also one of our country's most expensive diseases. Nearly 1 in every 5 Medicare dollars is spent on people with Alzheimer's and other dementias. Unless something is done, by 2050, it will be 1 out of every $3. We cannot afford to overlook Alzheimer's disease. Both the human cost and the cost to our healthcare system are simply too great. We must invest more in research to develop treatments to prevent or delay the progression of Alzheimer's disease, and ultimately to find a cure. Of all the statistics and data regarding Alzheimer's disease, perhaps the most upsetting is the immense gap between the amount we spend on Alzheimer's research and the cost of caring for those with the Alzheimer's disease. In 2014, the total cost of Alzheimer's was $214 billion, including $150 billion to Medicare and Medicaid. During the same year, the National Institutes of Health invested only 0.25% of that amount, $566 million, in Alzheimer's research. This year, cancer research will be allocated an estimated $5.4 billion in federal funds, and heart disease will get $1.2 billion, while Alzheimer's and other dementias will receive a fraction of that, of $586 million. Simply put, it's imperative that we provide NIH with robust, sustained funding which will allow it to support Alzheimer's research that is so desperately needed. Mr. President, let me make it clear. I strongly support the research dollars going into cancer and would like to see more funds put into it. I strongly support the amount of funds we're putting into heart disease and would like to see more funds put in. I know there's bipartisan support in this Congress to increase the pie that NIH has, the funds that NIH has, because we understand it advances the humanitarian need in our country to find the answers to diseases, but also creates good jobs. We need to dramatically increase the amount of resources that we make available for Alzheimer's research. We must also support innovative, evidence-based models to address the needs of those currently living with Alzheimer's disease and their family caregivers. I am proud to tell you about the Maximizing Independence at Home, or Mind at Home program developed at Johns Hopkins in my home state of Maryland. In the Mind at Home program, an interdisciplinary team provides home-based assessments, care coordination, and support to individuals with Alzheimer's disease and other dementias, allowing them to remain in their home longer, improving their quality of life, and supporting their family caregivers. During an 18-month pilot project, the Mind at Home program helped participants stay safely in their homes for an average of 9.5 months longer than would have been otherwise possible, while also improving their quality of life. We have an opportunity to improve the lives of millions of Americans suffering from Alzheimer's and the lives of their family members by building on the success of programs like Mind at Home. This June, in honor of National Alzheimer's and Brain Awareness Month, let us pledge to provide robust, sustained funding for NIH so it can support much-needed research on this devastating disease. And let us pledge to support innovative programs like Mind at Home to improve the quality of life of those currently living with Alzheimer's and their family caregivers.